Back in 1974, business writer Peter Drucker wrote and encouraged people to define the purpose and mission of their business as a strategic imperative, the classic corporate mission statement. Hi, I'm Dr. Johnson, also known as the Floater Doctor. This is a shorter episode in my masterclass for eye doctors in the management and treatment of clinically significant vitreous opacities, also known as eye floaters. I am the Floater Doctor. So, Mr. Drucker wrote this article and encouraged companies to develop a mission statement. And it became very popular in the 1980s. You'd see it everywhere. All of these big multi-billion-dollar companies would have some sort of aspirational statement. And but you don't have to be a billion-dollar company to stay focused on the values and create a mission for yourself. Well, guess what? I'm just one guy in my practice, and I also have a mission statement. And I'd like to share that with you for those who might be interested. Now, I will say, here's the caveat. This might not apply to you if you're a doctor in a busy practice and you do a lot of other things. So I'm not saying this needs to be your mission statement. I'm just saying this is my mission statement. Just like with all of these episodes, I'm not saying here's the way to do things. I'm just saying here's how I do things. But I think it does, like I said, it reflects my value system. So the first item is first, do no harm. When we graduate from medical school, the Latin term is primum non nocere, which is first, do no harm. Pretty self-evident. There's never value. It's never worth getting any money from somebody if you've caused them harm or distress or made things worse. And so I do my best to try to avoid that at all costs. And that includes sometimes walking away from treatments, especially the younger patients. I'll tell them in advance. They'll contact me and they'll say, hey, I'd like to come and travel from out of state to come and see you. And I look at the note and I'm like, you're 25 years old. I'd actually kind of discourage it. So part of doing no harm, I think, is also managing expectations, knowing what to treat, knowing what to walk away from. Minimize risk as much as possible. It's never a zero risk proposition. Getting in your car and driving down the freeway, highway, is not a zero risk proposition. But if you can make good decisions and treat what you can, walk away from what you can't, you can minimize that risk as possible. So first, do no harm. Second, improve the quality of vision and quality of life by treating people's eye floaters. Well, that's kind of obvious. That's what I do. I am the Floater Doctor. That's all I do. And so that is quite obviously should be part of my mission statement. And again, it's not just improving the quality of vision. Like really deeply tied into that is the quality of life. There was a survey of people with eye floaters, and they found that a surprising percentage of people, of these floater sufferers, would rather have asymptomatic HIV rather than have their floaters. You can find on the subreddit, eye floater subreddit within Reddit, where it's basically a discussion forum for floaters. Like there are people ideating suicide, like thinking, I can't live with this. I literally can't live with this. That's pretty drastic. So improving the quality of vision, treating the floaters is improving the quality of life, and that's really what we're trying to do here. Number 3 is be the best at what you do. Okay, that might be a little aspirational, but I am the best. Be the best at what you can do. Try to be the best at what you do. Always be learning, always be better, and learn from your mistakes. There is a natural ego protective mechanism in all phases of our life. It's tempting to blame the patient. Oh, they're making a mountain out of a molehill. Oh, they're just a complainer. Oh, they'll never be happy, with the results. The cataract surgery is perfect. I don't know why the patient is still complaining. Sometimes it's important to say, what could I have done different? Should I have managed their expectations better? Should I have walked away? Should I have just looked at that and said, maybe a vitrectomy would be better suited for you? I have a video that I call the Croatia incident where I misjudged. Essentially, I didn't see this person's floater, and the last couple of visits, I'm like, don't see it. It must be microscopic. You'd have to learn, we can't have it perfect. And then they came back and I took a look again and I'm like, oh, there it is, And so it was a humbling experience for me. And I learned from that. So, be the best at what you do and, keep learning. Number 4 is the golden rule. That brings in everything. Treat people the way you'd want to be treated. That can be both in the way that you manage their expectations, like I just said. That's respectful. Being empathetic. Saying, I get it. I understand your problem. I can see why this is really distressing for you. Minimizing their complaints. Offering just platitudes of reassurance like, oh, I have floaters too. I just ignore mine. They don't want to hear that. That's not the way I would want to be treated. How would you like to be treated as a floater suffering patient? Or in all of medicine, as a patient in general? How would you like to be treated? Respect. It's simple. Now, that can also be a bit more complicated on the financial side. I do not get paid for firing the laser. The value system that I've created for myself is I need to be delivering value for this person. What does success look like? At what point can we say that this is a successful treatment or successful series of treatments? What does that look like? It's a subjective phenomenon. Floaters are a very subjective phenomenon, kind of like pain. If you ran a pain clinic, how would you structure that? Is it just, look, my time is my time. I spent time with my patient. I'm billing for this interaction. It was a complex interaction. It was a simpler interaction. That's what you get paid for. I've turned the tables on that. I really do believe I need to be delivering value for that patient. And sometimes, despite my best effort, my best skill set, my best intentions, my doggedly determined effort, sometimes multiple efforts, sometimes I'll just say, I can't get it better. I can't get it good enough better for you. Maybe you do need to consider the vitrectomy. And by the way, you don't have to pay me. I haven't delivered that value. That's a really unusual business model. And I think this is probably the first time I've ever mentioned this, on a video, or on my website or anything else like that. But the people who come here know, they know. That's not it's a judgment call. But I have to be convinced, and we both have to be convinced that I'm delivering value for that person. Now, I can do that because I don't have other doctors as partners. I'm not taking money out of their pockets. I don't have the bean counters upstairs saying you have to spend this many minutes with a patient, and you have to bill for this, and you can't do that. I'm the boss. Who's the boss? I'm the boss. I get to do whatever I want, and that's a very important part of my practice. And the last item is, I'm in the vitrectomy avoidance business. This is what I do. The vitrectomy is a more invasive, more risky, problematic procedure. In people who have not had cataract surgery, you can almost guarantee it's going to cause cataracts. And if you're 20, 30 years old, that can take away function of the eye. And just finding somebody willing to do a vitrectomy for you when you're in your 20s and 30s is problematic as well. I don't look at the vitrectomy as my direct competitor. They are not equal. It is part of a stepped approach, which I'll talk about in another episode, a stepped approach to treating floaters. I am trying to get that patient a lot better, significantly better. A place where that patient can say, this I can live with, this is a lot more comfortable. At the end of the day, I haven't really been thinking about my floaters very much, and I don't have to consider a vitrectomy. I'm pretty good at that, but it's not 100%. I have had, over the many years I've been treating floaters, a couple of handfuls maybe of patients who've gone on to have a vitrectomy. Those are the ones I know of. And occasionally I'll find out about them. They might contact me by email. Most recently got a comment on my YouTube channels. Some of my patients who I have treated, and maybe sometimes treated reasonably successful, got them to 70+% better. But they did go on, that last 30% was just still unacceptable, and they went on to have a vitrectomy. And most of them have done very well with that. They're very, very, very happy with it. And it's not a personal affront or professional front. I'm happy for them and good for them. They had to take this in stages, and they had to go through the laser treatment stage first, and if that didn't work for them, then they can always go forth with the vitrectomy. But I've had some feedback on some patients who've gone on to have vitrectomies, and they've had some problems, and I'm aware of other cases where people have had vitrectomies and they've had some very significant problems. I'll tell that story in another episode. And so when they come to me, I say, look, if there's nothing that I would do at the laser that would preclude you from pursuing a vitrectomy later on, but let's try to prevent you from ever getting to that decision node, that decision, and having to do this or that. And so we'll try the laser first. Anyways, that's my corporate mission statement. Like I said, it may not convey to other business models and other practices because I'm so specific with what I do. But it might help you understand my professional and personal values system and how I try to remind myself to do the right thing in all aspects of my practice. So I hope you found this helpful. Again, I'm Dr. Johnson, the Floater Doctor. I will have many, many more episodes. If you find this information helpful and you wish to see more, you can subscribe, you can hit the notifications bell, and or share this with somebody who might also find this helpful. Thanks for watching, and see you next time.